At South Texas Health System Children's, your child's health is our priority. When they're ill or injured, we're ready to help. Our team includes on-staff pediatric specialists in infectious disease, cardiology, orthopedics, neurology, ear, nose, and throat, and more. Our round-the-clock care features the Valley's first dedicated children's ER. For more than 15 years, we've offered healing and hope for kids. And we're here for your family now. South Texas Health System Children's.
Where kids come first.
Greetings and welcome to our latest Let's Talk Children's Health webinar. I'm Tom Castañeda, the System Director of Marketing and Public Relations for South Texas Health System. On behalf of the STHS Children's team, thank you for joining us. Prioritizing children's health is vital for their present and future well-being. It lays the foundation for healthy physical growth, strong mental and emotional development, and better academic performance. It's not just about avoiding illness, it's about fostering resilience and capabilities for a fulfilling life. So to help parents prioritize their children's health, STHS Children's hosts these monthly Let's Talk Children's Health webinars. By offering education on common health issues affecting kids, parents can help maintain their children's health and overall well-being.
You can bring them anytime. We'll check them to make sure they're okay. We talked about the signs that we look out for. The biggest one that concerns me when I see a child in the ER is their level of activity. And if they're really, really down, then we get very concerned about that.
All right, so let's go through just to rehash some of that information. So obviously the causes of dehydration. So it's not just spending time outside and the sun and the elements. It's also, you mentioned illness. So gastroenteritis, illnesses like that can lead to more vomiting and diarrhea. What is it about the vomiting and diarrhea that's sort of also taking the liquids with it?
Yeah, so in general, with any illness, as long as you can drink, you're going to do okay. You're going to stay hydrated. But if you start vomiting, you can't really keep up with that. So, when we see a lot of children come to the ER for vomiting, and most of the time we can fix that. We have medications that work really, really well to help vomiting stop. And as long as we can stop it, and the child is able to drink, keep up with their illness, they'll do fine. But if they're sick with a fever, or they're just sick and they're vomiting, we can't stop it, then there's other things that we have to do.
And then we have fever is also something that can result in dehydration. And obviously when you have a fever, you're sweating more, and so you're obviously releasing the fluids that way.
Yes, so yes, when you're sick with a fever, you generally will need more fluid. You just need more. Because you're releasing a lot more, not just through sweating, but just, your heart beats really fast, you breathe fast, and so you're spending a lot more energy, your body's spending a lot more energy when they have a fever. So it's very important to keep them hydrated. And
what is that advice for keeping them hydrated, especially when they're experiencing that fever that's really high, above the 100? What is your best advice to making sure that they stay hydrated?
Yeah. Well, the first thing to understand is that the fever's not going to hurt the child, okay? It's not harmful no matter how high the fever gets. We'll see kids in the ER with like 106 fever.
Oh, wow.
We give them some Motrin, they're running around like nothing ever happened to them, but you got to understand the fever's not harmful, but it doesn't make the kids feel good. So I always recommend to do your best to bring the temperature down. Ibuprofen works really well. Acetaminophen work really well. So long as you're giving the right dose, bring the fever down, they feel better, then they can do all the things that they need to do to get better, such as drink. Okay, and that's super, super important that they drink.
All right, the next one is inadequate fluid intake, so not drinking enough water, which is probably the most common thing that we see when it comes to dehydration, especially in the summer. So how much water should kids be drinking?
Yeah, so in summertime, not drinking enough is what's going to get them in trouble. And when they're out there running around, especially in situations with sports and they're sweating a lot, it's just important to have water available to them all the time. Taking frequent water breaks to make sure that they're drinking, but then also it's important really to look at the kids and see how they're doing. If they start having things like I have a headache, or things that might suggest they're being dehydrated. You got to take them off to the side and say, look, you got to sit down and start drinking plenty of water.
And then the last one is a sore throat or sore mouth. That pain can actually make it really difficult to drink. So I can understand that. I've had a sore throat before, and you want to avoid anything, and so not being able to really drink because of the pain.
Right. There are some viral illnesses, or even things like strep throat, which is a bacterial illness, where the throat hurts. It's painful, and so a lot of the kids, most of the kids will drink, but some of them just absolutely won't. And the best we can do is, and the best that you can do as parents, is to treat what the problem is, which is pain. Treat their pain. Acetaminophen, ibuprofen work well for fever, but they also work very good for pain. You give them the pain medicine, and then you hope that they'll drink. We do see some kids, Tom, that we have to keep in the hospital because they just absolutely won't drink, and it's because it's too painful for them. So, the best we can do is give them medicine to treat the pain, and then hope that they drink. Most of them will do fine.
As a physician, while you put them on that pain medicine and you're trying to get them to drink, are there any tricks that you use, like ice chips or anything that kind of gets them a little bit of water at a time?
Yes, absolutely. That's a great question, Tom. So, cold things tend to be better. Popsicles work really well. Kids love popsicles. You got to think about, if your throat's hurting, you don't want to give them things that might hurt it, like orange juice, right? Give them things that are more soothing. And so long as they can drink it, they should do fine. I'll tell the parents, if all they want is milk or a milkshake, let them have it. They just need to make sure that they drink. And occasionally we will have to resort to, Tom will have to give them fluids with a syringe. Okay. Occasionally we'll do that. It's uncommon, but sometimes we can do that. But if it's to that point, it's going to be tough to manage them at home.
Now, you did talk about the warning signs and symptoms of dehydration. So let's go through some of those warning signs again. So they're playing less than usual. So you have a kid that is always active, they're always running around, and they're not really moving as much. That's a telltale sign that something may be wrong when it comes to hydration.
Yes, absolutely. And again, the biggest telltale sign of being dehydrated is their activity level. So that may be an early sign. They're still up and around, but they're just not as active as they normally are.
They urinate less frequently, so they're not going to be going to the restroom as often. Obviously, they don't have enough water in their system, fluid in their system to release it.
Right. So that's something, Tom, that parents may notice over a period of time. Like if they're sick for a day or 2 days, they might notice, he's not peeing as much. And again, you have we're talking about a bunch of different signs of dehydration. That's one of them. We will have parents come in who say, he's not urinating, but they otherwise look okay. And yes, that is one of the things that we look for, the lack of urine output, but it's one of many things that we look at.
And it's good to have that conversation with your child about how often they're going to the restroom, because you're obviously, as a parent, you're not necessarily noticing every time they go to the restroom, but it's worth having the conversation to ask, especially during the summer, when you know that they're spending a lot of time outside, to just be like, have you gone to the restroom today? When did you last go? I think it might be a little embarrassing for older kids, but I think it's worth asking, no?
Yes, absolutely.
Now, parched, dry mouth. So obviously, if you notice that's a telltale sign there.
That's another sign. Dry mouth, or maybe you notice some cracked lips, a sticky mouth. That's definitely one of the many signs of dehydration that we look for.
What is some of the relief when it comes to the dry mouth and the chapped lips that you see? What do you help them with, especially because it can be very painful to have chapped lips as a kid, especially. I can remember it was not fun.
I mean, the best thing is to make sure they're hydrated.
Yeah.
Really
avoid it at all, at all costs.
Yes.
All right, break out the chapstick if you need to, just to help them out.
Yes.
All right, now fewer tears when crying. So this is one of those telltale signs, especially for babies, and when you're talking infants.
Right. So, infants, when they're crying, you may not see as tears. Sometimes you won't see tears at all. I mean, the body is amazing. It retains as much fluid as it can. If it's feeling like it's dehydrated, it's not going to cry. It's trying to hold on to that fluid, and so that's definitely a sign of dehydration that we look for.
Sunken soft spot on the head.
Mm-hmm.
So we're talking especially infants here.
Right. So the infants around 6 months and younger will have what we call a fontanelle, a little soft spot on the head. And if they do get dehydrated, you may notice that it's sunken down a little bit more than usual. Most of the time it's flat, but when they get dehydrated, it may actually sink in a little bit. And that's another one of the things that we will look for, yes.
Changes in bowel movements. So obviously we talked urination, but also bowel movements will be impacted as well.
Yeah, they may not, go as often as they do. I mean, a lot of times, Tom, it's mostly because they're not eating when they're feeling sick like this, or mostly drinking. And so it's hard. That's kind of a tough one, for us to evaluate.
They're very fussy. That's another telltale sign.
Yes. I mean, once you get dehydrated, like I said before, what happens is your body creates a lot of acids to try to compensate to get yourself hydrated, and it just makes you feel bad. And so the little kids will get fussy like that. The older ones, they just don't feel good. They'll just lay around and sit around and don't want to do anything. So yeah, they can definitely be fussy.
All right. Excessively sleepy.
Yes. So I think that's the last one on your list, right?
No, there's more.
Okay, well that's the one that we worry about most.
And I was going to say, is that the one where if they are getting excessively sleepy, you really need to make sure that they're not going to bed, because that would be dangerous, because you're not really being able to track more.
If you notice they're just more lethargic, then they need to either get checked, or you need to jump on that and make sure they are drinking. If as long as they're not vomiting, you should be able to catch up with the fluids. Okay, but yes, once they start getting more sleepy than normal, or with a lot less activity, that's when you really need to be concerned.
Okay. Sunken eyes.
Sunken eyes too is similar to the soft spot. Okay, and that's it's a hard thing to notice sometimes for parents, but some parents do notice that, and it does happen. So that's definitely one of the things we look for.
All right. Cool, discolored hands and feet. So cold to the touch is actually a telltale sign that something's wrong.
Yeah, and the reason why that happens is because once you get dehydrated, your body sends everything to the center of your body to try to help your heart move, try to help your brain move, and it takes everything from your hands and feet, and yeah, your hands and feet can be a little bit cold.
Wrinkled skin. So the skin elasticity test is really something that you guys measure to see how the skin is doing, right?
Yeah, and that's a pretty late sign of dehydration.
Okay.
So what we do is, you can bend their skin, and if it stays bent, that'd definitely be concerned. Honestly, Tom, I've not seen a parent come in saying that their skin is like that, but it's definitely one of the things that we look out for as a clinician.
And then the last one is dark colored urine.
Yes, that's a good one. Yes, so as you get more and more dehydrated, your urine will turn dark. I mean, if you're hydrated really well, your urine's going to be clear. And that's actually, when I think about it, a good thing for the parents to look for. The color of their urine. If it's dark, then they might think that they need to start giving them more fluids. Okay,
now, what is the normal color? Because obviously, I know when I've had a lot of water, you'll see it clear.
Yeah.
But then, so what would be the normal color for urine?
Yeah, I mean, it should be clear to light yellow.
Okay, clear to light yellow.
Yeah. And probably with mild to moderate dehydration, you might start getting some darker urine. But that's probably the point where you start thinking, I need to get more fluids.
Yeah.
In this one.
Okay. And then let's talk a little bit about the problems that dehydration can cause. So obviously we have heat injury, so that is a serious issue that can become even more serious.
Yeah. So if you're outside, obviously, and you're getting dehydrated, you can get what we call heat exhaustion, which is not a terrible thing. It's something that can be fixed, with fluids, and many times it can be fixed without IV fluids. But once it gets to a certain point, and they start getting lethargic, like we were talking about earlier, or they're just not as active, then it's well beyond just heat exhaustion, and then we definitely have to fix that with IV fluids.
All right, and then we have swelling of the brain. So the brain swelling, how serious is that?
Well, obviously that can be very serious. That's a pretty uncommon complication, but that generally happens because the electrolytes, like the sodium levels and the glucose levels and the chloride levels, they change around a lot when you get dehydrated, and that can cause that problem. It's very, very rare, but we definitely see it.
Mm-hmm. Seizures, is that something that you see often?
From dehydration, not so much, but again, that's something else that can be caused by the electrolyte imbalances. If your blood sugar goes really low because you're dehydrated, you can definitely have a seizure because of that.
Mm-hmm. Shock, so experiencing shock in any form.
Yeah, so shock is actually where your body is really shut down and it's not able to push blood around to your organs, and that's very, very severe dehydration. And that we can fix usually with IV fluid. Sometimes we'll have other medications to help, to help open up the blood vessels so that fluid can get to all of the organs, and preventing and treating shock.
Mm-hmm. And then kidney failure.
Yeah, that's kind of the end result of the shock. We'll see that. Usually it's not permanent. Usually it's transient. Usually we can fix it, with IV fluids and being in the hospital. Mm-hmm. But we don't ever want to see those things. We want this to be prevented before it gets to that point.
Mm-hmm. Now, when it comes to, obviously, we're talking about kidney failure, we're talking about all of these very serious issues, but we talk about weight and how maintaining a healthy weight, the heavier you are, the more damage you're doing over time to your joints, things like that. So when it comes to hydration, frequent dehydration, does that have a serious impact on your overall health long run?
Honestly, I don't know.
If you're not drinking enough water over time,
yeah.
Are you hurting yourself over time?
I mean, most of the time you recover from these episodes of dehydration and you're fine,
Mm-hmm.
in the end.
Mm-hmm.
I mean, I've never seen someone have a long-term effect of multiple episodes of dehydration, but it's pretty uncommon, Tom, to see like one child coming in 10 times for dehydration. I think
hopefully you learn the lesson the one time and,
right.
and you make sure that it doesn't happen again.
Exactly.
Mm-hmm. Now, how is dehydration treated? So obviously you have those levels. So at the mild to moderate dehydration level, is it usually simply just getting more fluids, of those clear fluids that you talk about?
Yeah, so clear fluids tends to be a lot easier on the stomach, especially for those that are vomiting, okay? You can give clear fluids at home, and it's best to do it, if they are vomiting, in small amounts.
Okay.
Like, say for a baby, you'll give them a half an ounce. Wait for 5 or 10 minutes. The baby will be pretty upset because he's probably going to be thirsty and wanting more, but you can't let them chug down as much as they want. They'll just keep throwing up. So let them take that small amount, let it absorb into their system, then take another small amount 5 or 10 minutes later, and just kind of keep going from there. Most of the time, you can treat it at home like that. Obviously, as you get older, you're going to take more than a half ounce,
Mm-hmm.
but little bits at a time, and just making sure they're getting enough overall.
Now, severe dehydration obviously can result in you ending up at the hospital, in the ER, or hospitalized. How do you treat it when it gets to that level?
Yeah, so if you'd have to come into the hospital and get an IV, this is something that we do quite often in our ER. The children's ER in Edinburgh is staffed with pediatricians and pediatric nurses, and everything is geared towards kids. And we have a lot of things to make their visit much easier than you would think. And very experienced nurses that can, get IVs placed in without any, most of the time without any difficulty. And then there's special ways to give them the fluid. We can't give them a whole lot. We give them just, basically just the right amount, and see how they respond. And at the same time as they get fluids, we're waiting for lab work to come back. And many times the results of those laboratory tests are what make us decide, Can we fix this child in the ER with some IV fluid, or do we have to keep them in the hospital?
Mm-hmm. And what are those signs when you have to keep them in the hospital? What shows up in those results that you say, okay, now we need to hospitalize them?
Mm-hmm. So we talked about having acids in your system. Many times we'll just see an excess amount of that in their system with the lab results that we do. If their blood sugars are really low, even though we can fix that in the emergency room, we don't necessarily want to send the child home to have them potentially have another low blood sugar at home. Other electrolyte problems, like problems with their sodium, are things that we would keep them in the hospital. And then how they respond. If they get the fluid, they feel better, they start drinking good, they stop throwing up, you'll probably send that child home. But if their laboratory levels look fine, but they're still throwing up, or they're still having a lot of diarrhea, then usually we'll kind of give up and keep them in the hospital.
All right. What are oral rehydration solutions?
Okay, that's a good question. There actually are solutions that the World Health Organization have created. They're not as important here in the U.S. just because most of the kids here are well nourished, unlike kids in in other countries. But for the most part, it's probably best to give fluids that have things in them, like sodium and potassium. And you find that in Gatorade, you find that in Pedialyte, probably the more common solutions that we'll use to get them hydrated.
So if you were going to have something in your refrigerator other than water, would you recommend having a bottle of Pedialyte on standby, like just having it to make sure in case of emergency? For sure.
Most of the other kids don't like it so much because it doesn't taste well.
Yeah.
It's got kind of a salty taste to it, but Gatorade is a fine thing to drink also.
What is the difference between like a Pedialyte and a Gatorade in terms of the consistency that you would need for those electrolytes?
Yeah, I don't know exactly
the exact number,
but there's probably a little bit more sodium in the Pedialyte. That's probably why you taste it so much. Mm-hmm. But they're in general, any fluid, Tom, is good. Mm-hmm. If they can, if all they want to drink is milk and they hold it down, I tell the parents, just let them have it. Whatever he wants to drink, as long as they're not vomiting, they can have whatever they want.
Mm-hmm. Now, a parent brings a child into the ER at STHS Children's with severe dehydration, let's say. What can they expect when they come in?
So what normally would happen is they would come in to see the nurse first and triage. They would get their vital signs. The nurses are very good. They're very good at picking out the sick children, and they'll come let us know right away, and we'll start seeing that child. If they're severely dehydrated, we'll start working on them as quickly as we can to make them feel better and to get them hydrated. Mm-hmm. So the triage process is usually first, and and then we can usually get people back to get seen fairly quick, and but if it's someone that's very sick, we get told right away, and we'll get started on things right away.
And when would they require the tests, like the labs? You won't necessarily always get a lab done unless it's a very severe case, is that right?
Right. I mean, you can pretty much tell. I mean, the ones that are real sick, like I said, they're just not very active. Sometimes they'll have signs of that acids in their system. You could actually smell something on their breath that has a fruity smell to it. And so, once we identify that, we can identify fairly quick. We can get started on them. They would get an IV placed, which is definitely a painful procedure, but we have things in the ER to make it not so bad, from numbing up the skin before they place the IV. Mm-hmm. And at the same time they place the IV, they'll draw lab tests, so they don't have to stick the child. Minimal needle sticks, mm-hmm. And then they'll give them the fluids, and we'll just kind of see how they do. Mm-hmm. Most of them do really well.
Now, a parent is coming into the ER, and they should be. You want them to be able to answer some important questions to help with the evaluation. So one of the things would be the severity, right? So you want to be able for them to be able to describe how severe the symptoms they've noticed in their child, right?
Yes, absolutely. So, especially if they're vomiting. how many times have they had vomiting? When did the vomiting start? When was the last time they vomited? These are things that are important for us to know. The diarrhea, is it 2-3 times a day, or is it 10 times a day? Is it like, there's a lot of things that we'll ask, and we ask a lot of questions. And most of the parents will know the answers to all those questions.
But sometimes it's good to have a notebook and be writing some things down, just because when you have those conversations with the doctor, you don't necessarily want to forget something.
Yes.
Again, duration, like how long have they been experiencing the symptoms is really important. Have they been responding to home treatment? So that's something that you may want to know, right? Like, is it working when you're giving them the water?
Yes, exactly. When you give them liquids, do they hold it down, or they keep throwing it up?
Yeah.
And if they vomited 4 or 5 hours ago, have they been drinking since then? How much have they been able to drink? And so yeah, we ask all those questions. And like I said, most of the parents will know the answers to those things.
Are there any age considerations when it comes to the treatment? Obviously, when you're dealing with infants versus adolescents.
Yeah. The treatment is probably the same. It's the first thing to do is evaluate them, determine, dehydrated or not. Do they need IV fluids or not? We give IV fluids to little babies. Like, we're a children's ER, and we have very experienced pediatric staff that do this. And so a little infant may need IV fluid just like a teenager. They wouldn't get the same amount, but they would get the same equivalent amount based on their weight. But yeah, we treat it the same.
Okay. And then I think we always talk about the importance of trusting our instincts. And so if a parent notices some of the symptoms, or just something doesn't seem right, it really is important to either call your pediatrician or family doctor, or come to an ER, right?
Yes, and I would, especially if you have young children, would highly recommend you go to a children's facility that takes care of kids. A children's ER, a children's urgent care, anything geared towards kids. Sometimes if you take your child to places where they're just not used to seeing children, they just get very nervous about it. But and I'll tell parents, if you're at all concerned about their hydration status, just bring them. We'll check them. We'll make sure that they're okay.
Now, how do you fix dehydration fast? Is there a way to especially if it's just in the mild to moderate stage, is there some quick fix that you can recommend?
Well, for mild to moderate, probably just have them rest and drink. There's really no other treatment for that. Just to make sure to rest and drink. And that's why if they keep throwing up, even if they're mild and moderate, but they're still throwing up.
Yeah.
They're not to the severe point yet. We have things to help. We have medications to help stop vomiting, so that they can actually do it themselves rather than with an IV.
What does the start of dehydration feel like? How would you be able to describe that for a parent or a child who may be watching to understand what it might look and feel like when the beginning stages?
Yeah, so like we talked about before, probably the biggest thing is just a decreased level of activity.
Okay.
Now, when it gets to where they're not active at all, very, very concerning like that. And then, all the other signs that we talked about, the lack of tears, the urine output. There's a lot of things that we look at, and we take all those into account. Sometimes if they just have one symptom, like they're not urinating as much, but everything else is okay, and we're probably fine, so long as they can drink okay without vomiting.
All right. And then are there any foods that we should avoid if we are starting to feel dehydrated?
Well, it's probably not a good idea to take food, especially if you're vomiting.
Okay.
We'll tell the parents, a lot of parents feel like their child needs to eat, and really it's not important to eat. They really need to drink. Drinking is very important. But if they're able to eat, Tom, and hold it down, they can have whatever they want. Okay, and it's actually a telltale sign to us that they're actually probably doing fine.
Okay. And then I know that there are common challenges that parents face. Unfortunately, kids like to say no a lot. That's probably the first word they learn. So what do you do if a kid, what advice do you have for a parent if their child refuses to drink water? Trick
Yes.
them with a popsicle,
Well,
some ice chips?
That's a good question, Tom. But the nice thing about kids, if they're thirsty, they're going to drink. Okay, so if they don't want to drink, it's probably because they're not thirsty. Okay, but yeah, popsicles. Most of the kids will like popsicles, and sometimes that's all they'll take. And if that's all they'll take, then give them popsicles.
Now, if a parent is going to be sending out, there's a lot of summer camps that are happening right now. I hear about a ton of them at the McAllen Boys and Girls Club and several places. If a parent is sending their child out to do any physical activity, how much water should they have, and how much before that activity when should they have it before that activity? How soon before it?
Yeah, I mean, if I would hope and think that the summer camps have things in place to prevent dehydration. I presume that they do, but yeah, it's certainly completely fine to send your kid with, drinking a bottle of water before they get in there. It's completely fine to do that.
Like, hey, they're going to be working out, so I'm 20 minutes before, an hour before, just making sure that they're consuming some water to kind of hopefully fill their bodies a little bit.
Yes, very good idea.
Now let's talk about prevention tips. So obviously meeting daily hydration needs is really important. How much water, once again, should children be drinking a day? I know we talk about like 8 glasses of water for adults. So is it the same for kids?
It's not the same. I mean, water is not, when they're infants, you don't want them to drink a whole lot of water. You want them to drink things with calories in it, like the formula, obviously. But there's actually data on how much fluid they should take, not necessarily just water, but all kinds. And the kids, like I said, when they're thirsty, they'll drink.
Yeah.
And when they're not thirsty, they won't. I would just say, definitely have things available for them. In case they feel like they're thirsty.
And then monitor fluid intake is really important. So just really trying to keep track. And I know that there are parents who have water bottles that they supply their kids, so they're able to say, how many times did you fill this? Things like that. So just monitoring the fluid intake any possible way you can.
Yes, and there's other ways to do that too, like how their urines look, how many times they're urinating in a day, how active they are. Those are all ways to monitor their hydration status. But in general, as long as they're not ill with an illness, they should do okay.
All right. Now, Dr. Kanthu, I, as a child and as an adult, was never and am not really a huge fan of water. I should definitely drink more water. I've been trying to drink more, but are there any fruits and vegetables? I know we talk about like fruits that are like strawberries, watermelon, cucumbers are really good with. Are there any that you would recommend for parents to make sure that they have as snacks for their kids? For those like me who didn't appreciate water as much.
Well, clearly fruit is a great snack. I mean, if the kids like fruit, have lots of it for them. So many kids nowadays are, as you know, they eat a lot of things other than things that are necessarily good for them. But fruit is a very good snack. And it actually has quite a bit of water in it, so it'll probably help them stay hydrated too. Unlike chips, right? Chips have a lot of salt in them, and they kind of take away your hydration status.
Now, why is it so important to avoid sugary drinks, carbonated drinks like a soda? Why is it so important to avoid those?
Well, I mean, they have a lot of sugar in them, and sugar can have effects on their behaviors, and it's definitely much better for them to drink water. Water is probably even better than Gatorade and those kind of things.
Okay. And then let's talk a little bit about heat-related illness, because we are, once again, in the dog days of summer, we're experiencing these really high temperatures, and there's different types of heat-related illness. So what is heat rash, and what would you notice with heat rash?
Yeah. So heat rash, so we'll see that in sometimes in little babies. if it's really hot, especially if they're covered up a lot. You know, the parents may think that they need to be covered because they're a baby, but they'll get a rash that's just, you can kind of feel it, and it's very red, and it's from being hot. I mean, the way to treat it is to keep them cool. You know, don't cover them up so much. You know, bring them inside. Hopefully there's, you know, air conditioning where they're at, and there's not any cream that we could put on it to make it better. It's just really keeping them nice and cool. Now the other rash that we'll see in the kids that are with like heat exhaustion, they just get red, you know.
Yeah.
And that's a different kind of rash that we might have to treat with IV fluids. But
So the next one is heat cramps. So what do heat cramps feel like?
well, they're just like regular cramps. You know, your muscles may get cramped up. That is definitely another sign of dehydration that we'll see in the older kids that are out and about running. If someone is cramping up, most likely it's from being dehydrated, and you know, they just need to drink more fluids.
Pickle juice, I know, is for cramps. It's supposed to be amazing. As a tennis player who got cramps, I know that would help almost instantly. Now we're getting to the more severe ones. So heat exhaustion. What are the telltale signs that somebody may be experiencing heat exhaustion?
Yeah, so those are the ones that are out and running around, and all of a sudden they get very tired. They're getting headaches. They're just not feeling good. Those kids, you really need to sit down and just have them stop doing what they're doing, and hopefully you can get them to drink and overcome that. You know, have them rest and stay out of the sun, and drink a lot of fluids.
And that one doesn't necessarily require hospitalization unless it gets to the stage of heat stroke.
Yeah. So if they're just not getting better, then they should come in, and we can fix it much quicker with fluids through an IV.
And then heat stroke. Tell us, what is heat stroke, and where are those dangerous signs that you really need to be heading to the ER?
Yeah. So hopefully you won't see anyone with heat stroke out there, but those are the ones where they'll start actually getting a fever. You know, and even though they're not sick with an illness, they'll get a fever from being out in the sun. They're, again, not very active. They're lethargic. They're very red. If you actually had ways to check their vital signs, you might notice their blood pressure is low, and, you know, things like that. But that's not something you do out in the field. But once they get to where they're just not getting better, then they should really come in.
And we talk a lot about preparing ourselves to be outside. So obviously wearing light colored clothing, loose fitting so that it's not too tight. I know, definitely don't wear jeans in the summer. You will sweat most certainly, but loose fitting clothing, light colored, light in material as well. Linens do really well, cotton, a light cotton blend or whatever it may be. And then staying out of the sun as much as possible between the hottest time of the day, which is like 10 o'clock to 4 o'clock. Is you really try not to be outside if you can avoid it. Right.
Yeah. I mean, for sure. Sometimes if you're in different sports that are going on right now, you can't avoid that, but definitely try to spend as much time as you can out of the sun.
And if you are going to be spending time outside, try to seek shade or go inside for some breaks every so often, every 40 minutes, 30 minutes or so, just to try to get a little bit of a cool off moment.
Right. Right, exactly.
Now, last question, when should we seek medical attention if we suspect that our child may be experiencing dehydration?
So if you're concerned at all, they should come in. I mean, if there's a concern whatsoever, they should bring them in. Definitely look at their activity level, and we talked quite a bit about that. If they're just laying around, not doing anything, these kids will get to the point where they feel so bad, even though they're dehydrated, they just don't want to do anything. They don't want to drink. They have to get checked. Okay, that's definitely when they need to come in, and hopefully you can. After this talk, you can avoid your child from getting to that point, so you can maybe bring them in a little sooner, so they can get evaluated before that happens.
So just drink plenty of fluids, and be aware and trust your instincts.
Yes.
All right. Well, thank you so much, Dr. Cantu. We really appreciate you having you here joining us. This is one of several times that you've come by, and you always have such great information for us.
You're welcome, Tom. I appreciate it.
All right. And that officially concludes our webinar. Thank you for joining us. We hope you will continue to prioritize the health of your children. And we look forward to seeing you for our next installment of this Let's Talk Children's Health series on Wednesday, July 16th from 5:30 to 6:30 p.m. when we discuss back to school readiness. Like and follow the STHS Children's Facebook page for more details on our future Let's Talk Children's Health webinars. And to view our previous Let's Talk seminars, all you have to do is visit sthsletstalk.com. Until our next seminar, stay healthy, stay safe, and please continue to prioritize your health and the health of your little ones.
At South Texas Health System Children's, your child's health is our priority. When they're ill or injured, we're ready to help. Our team includes on-staff pediatric specialists in infectious disease, cardiology, orthopedics, neurology, ear, nose, and throat, and more. Our round-the-clock care features the Valley's first dedicated children's ER. For more than 15 years, we've offered healing and hope for kids. And we're here for your family now. South Texas Health System Children's,
Where kids come first.